Hello again, this is Dr. Mike Ballas, and I want to talk about one of the particular approaches used in the practice of holistic health care, and that's the practice of nutritional supplementation. Now, I'm going to make this a pretty narrow topic today. I want to talk about the use of things such as vitamins, minerals, and herbs. Now, why do we use these and why are they necessary? Well, for several reasons. Number one, recent studies show that even people who eat a good diet, and I'll go into a later video what a good diet is, because quite frankly, I think it is extraordinarily misrepresented. But even people who eat a good diet, and as a preview, I'm talking about protein and vegetables, even when you're eating that way, studies have shown that the amount of nutrients in certain foods has dropped 50%, and by the way, that's just in the last 30 to 40 years. So the amount of calcium in a head of broccoli might be half of what it was when you were a kid. The amount of vitamin C in an orange might be much, much lower. And we could go on and on and on. So nutrients in food, hey, we definitely need to get them. But do people get enough? I think virtually everyone falls short, even when you're trying to do the right thing. Let's forget about people who are eating lots of refined, processed foods, fast foods, or hammering things like processed grains and sugars. That's another topic entirely. They're in severe need. There's another thing we have to realize. Modern food is stored and shipped. And there are great advantages of this. I personally enjoy not having to hunt for my dinner every night or every couple of nights. But there are issues here. We don't eat food. We don't eat it as soon as it's killed. We don't preserve it right away. So we lose nutrients. You ever heard the idea of like fish oils, right? You heard that talked about in various commercials. Well, guess what? It's one of those things that when it's needed is extraordinarily important and very deficient in the average person's diet. Let me give you a tip-off. You ever know certain people, maybe you're among them, who when the fall and winter time comes on, your skin gets kind of dry and a little scaly and doesn't feel good? I'm going to be a little facetious here. That is not a deficiency of Vaseline-intensive care. I promise you that, it's not. Okay? These are deficiencies, and by the way, most of the time, that's in what's called the omega fat deficiencies, something I just referred to as sometimes fish oils. Anyway, we have a great number of nutritional challenges. Frankly, people have those going on. People are on certain meds that rob them of nutrients that are extraordinarily important. We're under stress. I think most people would agree more than ever before. Again, the list goes on. So I'm going to go over and just show you and bring back a couple of things of what I use commonly in the practice. So some of the things we'll use are specific minerals. All right, this one, for example, is a bottle of calcium. Well, people say, hey, shouldn't every woman over 40 be on calcium? Guess what? I'm going to say not necessarily. We'll get into that in another video. But we use certain forms of calcium, magnesium, sometimes what's called a multi-mineral. I commonly use, and in fact I'll go over here, a variety of food-based products. For example, this is something called Rosemary Supreme, which can be used as a multifactorial anti-infective. It works very, very well. There are some herbal products, but what I want to get to is nutritional supplementation, at least in this practice, is done specifically. This is not a one-size-fits-all approach. How come? Because frankly, that doesn't work. We're all biochemical individuals. We need different things at different times. And listen, I've had patients in the past I've treated who with other doctors, they dropped off, they came in, they said, I'm not feeling well. With one woman in particular, all I did was have her stop some supplements that she kept taking for years that, quite frankly, she didn't need. She got better real quick, by the way. All right? It doesn't make me a hero. All I'm saying is that these are wonderful things to happen. But like anything in healthcare, as far as I'm concerned, real healthcare is specific, done for the individual, and done in real time. And specific nutrition guided by kinesiology testing is one of the best ways to start to get back your health and to get your health to a high level and keep it there as time goes on. Thank you.